it's been 3 weeks since the province announced there would be targeted vaccinations in postal codes designated as COVID hotspots, like where I am now, in and around the Earl Bales Community Centre behind me. Since then, we've seen pop-up clinics at various spots with lineups that last hours, and now examples of residents being given direct notice at home only to be denied the opportunity to be vaccinated.
There's information that's going out, but it's too much information and some of it is conflicting.
This piece of paper delivered to residents in this building on Bathurst, south of Shepherd, was supposed to provide the good news everyone was waiting for. It was their turn to get the shot at Earl Bales Park, right across the street.
Very clearly states in the flyer that my building is a priority building, as this area, York Centre riding, is a hotspot. So I thought, absolutely ready to do this. I was met with an error message saying that all spots had been booked.
Kim Johnson went to the North York General website and then called, but came up empty on getting an appointment for a COVID vaccine over the last couple of days. Then she found out about this, a tweet from the hospital saying the clinic was open to all in the M3H community, and others jumped on the chance.
My sister-in-law sent me a message that they were doing appointments here. So I sent my husband, he stood in line for an hour down the street.
We found out through Vax Hunters Canada, the tweet, and we live very close by. We came rushing over. We got an appointment within 40 minutes.
Meanwhile, lineups persisted in other areas, at hotspot clinics in Scarborough.
We are disappointed because we have to wake up at 3 and came here at 4 and like 3 hours in a row.
The same at Albion Arena in the Jamestown area, northwest Toronto.
This catchment, this territory has the highest number of positivity rates and the lowest number of people who are vaccinated.
Those being told they're a priority in another hotspot area, however, still can't get theirs.
Why advertise that and then turn it around and say, okay, now it's open to everyone, even though there are people in the priority buildings who missed out?
City officials, those heading up what they call Team Toronto with healthcare partners, simply say they're doing the best they can, while mixed messages are sent to those in wait.
I expect that there may be learnings along the way and little bumps given the size and complexity of the challenge in front of us.
There is no single answer. There is no single process that is used because, frankly, there is no one solution that meets the needs of everyone across the community.
Now, 9 different buildings in this immediate area were identified as high priority on the flyer that Kim and her neighbors received. When we reached out to North York General to ask why someone living there wouldn't be given the appropriate amount of time to respond, we were told there were appointments that weren't filled, and so they needed to open them up.